Okay, so just an interruption for the during the presentation. Yes, we're right back, and so we're talking about those who are likely to be affected, and we realize that people who are of the ethnicity of Africans, Americans, Asians are likely affected. And for those who are joining currently, we are talking about the condition called spinal tuberculosis or tuberculosis spondylitis or curvature of the upper back. And so these are presentations that this condition presents itself. So as we are talking about those who are affected, the ethnicity. So this condition is no respecter of person, but a research that was carried out in Japan shows that there was a reduction in terms of the number of people who are affected. That is from 1978 to 2001 to 2005. It shows that there was a gradual or a retrogressive statistics of people who are affected by this condition. So the first one was there were about 734, and then subsequently there were about 276. That was in 2001. Then the last one in 2005 there were about 233, and that shows how people were being educated and preventive measures being taken on. But as of now, I'm yet to get to a statistic in Ghana. I'm sure there are some, but then I'm yet to get to one to show various definite statistics for this condition. So then, which people are more affected? When we talk about males and females, which people are more affected? But it is shown that statistically, males are more affected by this condition. So about 1.5 to 2 males are likely to be affected as compared to a male. So 2 males, when you put 3 persons or a group of people under context, about 2 males out of them will be affected, whilst just a female will be affected. And so males are more likely to be affected by this condition. This could be as a result of the fact that they are more exposed to intensive work, which could expose them to infectious disease. But then statistics could change, yes, per the country. This was taken not in Africa though, and so we'll say, how does this condition present itself? Like, what do you see in a person and how the person presents? So we talked about the fact that the person could present itself with curvature of the upper back. Yes, so we could have the upper back being curved, and this actually shown that about 40 to 50% of the people who have this condition have a curved lower back. Yes, that is a curved middle back. That is how some statistics have shown to have this condition present itself. And then there are states where we have a curve around the neck, and then you have the hunch nature of the curve at your neck region. But then it's very less of having this condition at your neck, as statistics have shown. And so about 65% of the conditions occur at the upper back, and then about 10-15% occur at your middle back, and then lesser of the cases are affected at your lower back. Okay, so when tests are carried out, when the patient comes to the clinic or the hospital, the patient presents itself with certain symptoms having to diagnose as spinal tuberculosis. So the patient complains of tiredness, weakness, but then we have special tests or special tests that as medical personnel we go through or we observe in terms of the back. And so when we touch the patient's back, we could feel tenseness of the back. So the patient has a tense back, and then there is localized tenderness. So when you touch the back, it feels like it's a bit tender. That is, it's soft and then easily arousable. and then there's more likely, or there's most likely in most cases, having a spinal deformity. That is, you have the curve at your back. But then, as we're talking about this condition, some people could have a mild form of this condition, which could go away unnoticed. But then, with the severe cases, that's when they present itself with having the exaggerated back. That's the curve at your upper back. Yes, so there could be initial signs of person having back pain, which is mostly presented by this condition. The person could have this middle back pain, the person could just have lower back pain, and if it's not taking notice of, if the other special tests are not carried out to see whether it's infectious, whether there is this degeneration, that is decrease in the bone density of the spine, if measures are not taken into consideration, the person could have a worsening of this initial state where we have the bones decreasing in size, and if it's not taken in, it will cause the bones to shift inside too much, and this will cause the upper back to collapse. So in the sense where the upper back collapses, so we mentioned the curves of the back and your neck. So if your neck is this way, if your neck is this way and your back is this way, if you have collapse of, and your lower back is this way, if you have collapse of a structure here which falls inside more, it could cause it to fall inside like this, which could cause you to have a hunchback this way, which you will see very soon. Some pictures will be shown very soon. I'm sure we will appreciate this very interesting topic. So yeah, so if you just joined in, we're talking about the condition called pulse disease, or some people will say spinal tuberculosis. Yes, some people also say, as medical practitioners will say, tuberculosis spondylitis. And we're talking about some of the objective tests that as medical practitioners we will do to, or will check to see whether the person has tuberculosis spondylitis. But then other tests also could include, you could see that when you pass your hands through the leg, the person doesn't really feel well. That is when we have the exaggerated form of this condition. The person could have weakness in the lower legs, the person cannot walk, or even the person can walk, the person has difficulty walking. The person could have nerve root pain, so when you touch the back, it would have abnormal sensation around the leg region. And as we mentioned earlier on, the person could have a curve, that's too much curve at your upper back, and these are all very important signs of this condition, and we should take notes of it. And then some personal sign, that is where we have the patient, him or herself, showing this sign. We could have in certain cases weight loss, so the person has drastic weight loss as the days go by, and then when you report to the medical doctor or the medical practitioner, it could have tests run out to see whether it is likely to be pulse disease or tuberculosis spondylitis. These are all symptoms that when we gather them together, we can definitely conclude on having this condition called tuberculosis spondylitis. The patient experiences night sweats, so in the evening when the person sleeps, the person sweats a lot. But we still stating this point: if you sweat a lot in the evening, that doesn't mean that you have tuberculosis spondylitis or pulse disease. They are just signs that could lead us to carrying out other tests to be able to see whether you have tuberculosis spondylitis. Okay, so other conditions such as when you have HIV, you could predispose you to have this condition called pulse disease or tuberculosis spondylitis, because your immune system has been compromised. So when your immune system, if you have infection, it could cause your bones to be degenerated. That's your bones to lose its strength, and when the bones lose its strength, it could collapse structures at your back and could have a curved back, and this could be as a result of pulse disease. Okay, so there are so many conditions or complications that are on the side way that could cause this condition called pulse disease. We could have HIV, as mentioned. We could have tuberculosis, which is actually the very key condition that could result in this other condition we call the Port disease or the tuberculosis spondylitis. And tuberculosis actually is a bacterial disease and can be transmitted airborne. So airborne means that when you cough, you could transmit it. When you sneeze, you can transmit it, and it's in the air. And so, by the grace of God, or God has made this in such a way that we have immune system that's able to fight these infections. But when the immune system is compromised, that is, you don't eat well, you don't exercise well, you don't have enough sleep, yes, you could have a low immune system, which any small bacteria or a mass of bacteria could compromise your immune system or could break down your immune system, and this could expose your immune system to infection. And when the infection gets to the bones, they could collapse these bones, and then they could cause you to have this hunchback that we are talking about, called tuberculosis spondylitis. Actually, this condition is treatable. Yes, at an early stage it's treatable, but when you take a long time before reporting to the medical practitioner, then you are likely to have your condition being worsened. Okay, so other conditions such as drug addictions, if you're taking a lot of drugs, cocaine, heroin, marijuana, tobacco, these are all livelihoods that could expose your immune system to be compromised, and these are very, very important. So you advise that you avoid alcohol. Alcohol could cause your bones to reduce in strength because they carry certain chemicals that could pull the calcium content in your bones, and when the calcium content in your bones are reduced, they could cause the bone to collapse or even be destroyed, and this could expose your spinal cord to anything, to distraction, and you'll be paralyzed, and then you have this condition called tuberculosis spondylitis. So if you know someone who drinks alcohol, in fact, we advise to resist in terms of taking in. And also, you have to eat well. If you're malnourished, you could prevent the bones from being exposed to enough calcium content. And in fact, we have to make sure that we eat well. Yes, eat well. And then other researches have been shown that people with low socioeconomic status have this condition. And then also some medication that we taking also could reduce our calcium content, and this could expose us to having this condition where we have collapsing of some of the structures in our bones, and then having this condition called tuberculosis spondylitis. Okay, so there are so many medications that could cause this. I'm sure our medical practitioners will be a very good person to explain to us more. Yes. And so, how do you notice that someone has this condition? Physically, yes, we can see that the person could have a curved back, and even when the curve is so small that it's not noticed. We have other investigations by the radiographers. They take pictures, we call x-rays, we could have also MRI, we could also have CT scan. These are all tests, that radiological tests that helps us to confirm or to diagnose this condition definitely. So we could have the MRI taken in, and we could see whether there's any exaggerated back or too much curve at the back. We could also see whether there is collapse of some structures at the back, and then other complications that could not be seen with the eye, and so that we can manage them as a total presentation. We could also have, if there's infection, we could also have the medical laboratory scientists come into place. We could also take something we call biopsy. We could take a portion of the vertebrae or the cartilages around the bones, and when we take it to the lab, we could see whether there's any infection. If there's any bacterial infection, then we could be narrowing it down to tuberculosis. And actually, this tuberculosis is actually from this original name called Mycobacterium tuberculosis, and this is actually this is the main organism that causes tuberculosis. The other organism that will cause other types of tuberculosis, but this is the main organism that we are looking for to diagnose this condition called the tuberculosis spondylitis. So if you have infection by lab test, we can say that yes, you are likely to have this condition called tuberculosis spondylitis. And then by the X-ray, by the MRI, which MRI is actually the best diagnostic tool for this condition, if we have tuberculosis spondylitis. We can see whether there's any infection, whether there's any dripping of the structures outside the normal alignment. So by the X-ray or the MRI, you can see a collapse of these bones, that the bones being disorderly or disorganized in terms of their normal structure. Could also have destruction of the intervertebral disc. We mentioned that the intervertebral discs are actually their rounded structure that each is found between two bones at your back. So the small bones at the back, the small bones at the back, in between them we have intervertebral discs. So when these discs lose their function, that is where they are unable to protect the bones from stitching against other, then we could have collapse of these structures called the bones. And we have infections that could also cause the bones to collapse or lose their strength. And then aside the MRI, aside the X-ray, we also have CT scans, and this actually helps us to see whether there are any lesions or there's collapse in the vertebrae or the bones at your back. Aside these, we have other tests that we can also carry out by polymerase chain tests. So many tests that actually it might not be beyond your control. I could say so many things about how to diagnose this condition, but then if you notice any sign of this night sweats, if you have any back pain, we need to report, or the mid back pain, to report to a doctor very early. That's why when we say back pain, in fact, I'm not trying to dispute any other professions, but then when we say back pain, you have mid back pain, neck pain, any other pain, you need to see the physiotherapist or you need to see the medical doctor to be able to see the exact condition at your back. You shouldn't take it as just any back pain, because there's so many conditions at your back which just massage or just any other thing could not be a definite way of treating your back pain. But then we need to see what is really at your back to be able to treat this condition. So if you have this presentation, just report to the medical doctor or the physiotherapist. Okay, so we're talking about the condition called post disease, which affects your upper back, where we have curvature of your upper back. We'll be seeing some pictures very soon, so let's stay tuned, and we can share the pages too for other people also to join to learn from us. So we talked about the same things, talked about the presentation, talked about how we diagnose it as medical practitioners, and then which people are more affected, which we've seen that males are more affected than females as a result of statistics that have been carried out. And then now we're talking about how to treat this condition. So how do you treat this condition? This condition, actually, when it's noticed early by medications, we can take out the infection that is likely to cause this condition. So if it's a tuberculosis that's causing this condition, we could treat it medically and it could eradicate this tuberculosis. And if it's other infection that could reduce the calcium content in the body, we can treat them medically. But then if other conditions such as collapse, that is fracture of the vertebrae, mostly it cannot be treated by medications, neither can it be treated by physiotherapy, because if the bones have been collapsed, the only option is through surgical means. And so this condition called post disease is actually treated mostly by surgical means when noticed late. And so we have surgical procedures that medical practitioners carried out, the surgeon carried out. And so we have spinal stabilization, so they put some rods at your back to straighten the back, and this helps to protect the spinal cord, because every human being, let's take into this statement, every human being has a spinal cord, and the spinal cord is actually the very, very key, it's actually a lifeline for every human being. So when you have alteration or attempts to distract the normal structure of the spinal cord, you could have so many complications, which one condition is called a post disease, and then could have paralysis, that is, you could have total weakness in your lower limbs or your legs, and you could be paralyzed. Yes. And so when you have this presentation, you have the curvature of the back, we should report as early as possible. This condition also can be seen um in anyone, in anyone. And so we could have other complications, such as could have heart issues, because when your spinal cord curves, it could have attempt to compromise the normal function of the spinal cord, which could affect your heart. It could have compression of certain vessels, because the bones would have been abnormally arranged, and this could cause so many conditions. It could have the bones being degenerated. Yes, there are so many other conditions. And so, as we've seen and talked about by word of mouth, we have so many aims of treating these conditions. And so medically, our aim is actually to take away the infection. So if there's infection there, we take in medication to eradicate the infections. Also, we're also aiming at to maintain your functional status. So if you are eating well, if you are passing out during, or if you are holding things, or if you are walking well, we are aiming to maintain that function and to prevent deterioration or further worsening of the condition. We are also aiming at also to ensure that your back is straight or is curved at the normal standardized curve that's supposed to be. And these are some of the aims of the medical practitioner in terms of this condition. And so we note that anyone is exposed to this condition. The young and the old can be affected by this condition, and so we need to take note of having to appreciate the fact that we need to report any back pain, any symptom of night sweats, any symptom of upper back pain, any symptom of infection, especially if it's tuberculosis, which is airborne. We have so many complications of tuberculosis, which one of these complications is Pott's disease. And so when we have this condition, it's important that we counsel the person very well, because it could affect the psychological state of the patient or the person. But in everything, there is actually a solution to it when person presents itself with the condition as early as possible. So we have certain treatment protocols as physiotherapists that we can go through to be able to stabilize the spine, take into consideration very important the spinal cord, because when we tamper with the spine and the spinal cord is affected, we could cause paralysis. And so the first thing is a physiotherapist will request for X-ray and see how complicated the back is before we carry out these techniques. These techniques could be spinal stabilization exercises, Maitland techniques that helps to restore the normal curve of the spine by pushing the bones either forward to normal alignment and also or backwards. But then the ultimate thing is to do strengthening exercises. So we have specific exercises that if you have curvature of your back, which we notice that it's become exaggerated, we go through. But then if the symptoms of pain, weakness, infection are still persistent, then we refer the patient to a medical doctor to be able to see whether there's any infection there. And so this will also be a very key note to be able to diagnose this condition as Pott's disease. It's actually a bacterial disease, but the physical symptoms are what we could have curvature of your back. And then actually it's also a condition that could be collapse of some of the vertebrae as a result of infection. So the infection can cause collapse of the back, and this could have an upper back curvature. This is actually a simple description of this condition called the Pott's disease. And so we could have exercises by the physiotherapist. If the person has back pain, if the person has upper back pain, the person could be treated with something we call TENS, transcutaneous electrical nerve stimulation. This is a machine that helps to reduce pain. The person can also be involved in aquatherapy or aquatic therapy. That is, the person goes in swimming. So swimming is actually very important treatment protocol for treating this condition called pulse disease. We could have aerobic exercises, we could have trunk strengthening exercises, which are actually specific exercises. These exercises are not just shown to anyone, so I can't even describe the exercises for you now, because if I show you this exercise and you do it, if there are other complications at your back, if we haven't carried out differential diagnosis, that is ruling out other conditions, these conditions that are on the silent at your back could bring up or could come up even if we treat this condition to be a success. And so exercises by physiotherapists actually specific, so every individual has his own exercises. Okay, so the other condition that we could have that could look like this condition called pulse disease, and so we have the brucellosis, we have candidiasis. I'm sure they are all big names. We could have septic arthritis, that is, we could have also infection at your back, but then this actually is very specific. That's why we have spondylitis, that is tuberculosis causing infection at your back. Okay, so we've seen some of the treatment guidelines as physiotherapists, what we can do, and then we've seen the medical aspect in terms of what medication that we can give. And so maybe you could listen to some of the medication that we can give as medical practitioners. It's actually very important that we don't self-diagnose. Even as we mentioned this condition or this medication, it doesn't mean that if you have curve at your back you shouldn't take the medication, but you see a medical practitioner to be able to give you the right medication. We have pyrazinamide, we have ethambutol, we have streptomycin. So streptomycin is actually an antibacterial disease which helps to fight bacteria, and so these are all medications that as medical practitioners can be prescribed for you as a patient or person experiencing these symptoms. So after we've learned a lot by word of mouth, we can see some pictures to see or understand this condition. So I've said a lot, so let's see how this condition presents itself. Let's not forget, it could affect anyone, it could affect children, it could affect adults, it could affect the young aged. Okay, so let's see the pictures of this condition. So I'm going to show a child who has been affected by this condition. Okay, so this is actually a child. I'm sure you can see it very clearly. A child who's having this condition. Yes, so this is actually a child. You can see the curve at the middle back here. You can see it very clearly. Yes, this is the child. You can see the protrusion at the back. When this is not taken care of, the person could have an exaggerated form. So you can see the second one is an exaggerated form of this condition, and so this is actually an exaggerated form of this condition. Could have also, with the X-ray, you could have the complications at your back. You can see this whitish substance here that shows the complications at the back, and this is an MRI. You could see from this side. Yes. So that is this. You can see the protrusion of the back there. So this is collapsing of the vertebrae. So you can see the vertebrae has been collapsed, and so we could have the back pushing inside like this. You can see it here. Okay, so this is an X-ray showing the back, and with this you can see whether there's any degeneration at your back. So this is actually some whites who have this condition called pulse disease. So this is the back here. You can see this curve here. So the person could have a curve there. You could see the person has hunchback, but then it's a condition called a tuberculosis spondylitis, where the bones have been collapsed and then having this curve here. So this is called a tuberculosis spondylitis or pulse disease, presenting itself with an upper back curvature. That is what some people might say the person has a hunchback. Okay, so you can see this on X-ray. You can see the curvature of the spine here is a bit curved here. So this is actually one of the researchers, one of the neurosurgeons who talked about this condition called tuberculosis spondylitis or spinal tuberculosis. So this is a new research in by the fact that it affects me. Yes, you can see it here.